My name is Dr. Dimuthu Vinayagam. I am one of the Cinnamon Healthcare GPs that will be providing remote consultations for you via MediRadar. Most of my patients call me Dr. D. I'm a full-time GP and I work across Surrey and Sussex, and I consult with a variety of patients across many different sectors. I look forward to consulting with you, and I look forward to helping you along your health journey and helping you address your health concerns. Polycystic ovarian syndrome, abbreviated for short to PCOS, is a commonly encountered hormonal condition affecting women that we see very commonly. PCOS can result in hormone imbalances, which then can lead to symptoms such as menstrual irregularities, difficulties with weight, difficulties with either excess hair, mainly on the face and body, as well as hair loss affecting the scalp. PCOS can also lead to problems with fertility. Some of the long-term risks of PCOS include pregnancy-related diabetes, which is also known as gestational diabetes, as well as type 2 diabetes in the future. Polycystic ovaries tend to be larger and bulkier than normal ovaries. When we scan them, we often find that they contain an increased number of follicles. Follicles are little fluid-filled sacs that release the egg every month from the ovary. Also, if blood tests are done, then this can show up certain hormone imbalances. It is often these hormone imbalances which lead to the symptoms of PCOS. The symptoms of PCOS are very varied, but the typical ones that we encounter include menstrual irregularities, such as irregular cycles or no periods at all, problems with skin, which include greasy skin as well as acne, problems with weight gain. Now this may be being overweight, this may be having difficulty in losing weight or in putting on weight rapidly. Other symptoms will also include things like fertility issues, which can then cause a delay in falling pregnant. The symptoms that we see in PCOS are often attributed to the hormone imbalances that we mentioned before. Typical hormones that are implicated in PCOS include testosterone, of which there might be excess levels, as well as insulin, of which again there might be excess levels in the bloodstream. Although PCOS is associated with fertility issues, it is still very important that women use reliable contraception to avoid an unplanned pregnancy. The exact cause of PCOS is still unknown. However, there often tends to be a familiar link, and therefore if you have a first-degree relative, a mother, sister, that is affected by PCOS, then your risk might be slightly higher. It's important to note that having polycystic ovaries does not necessarily mean that you have polycystic ovarian syndrome. Because symptoms can be transient, diagnosis of this condition can be particularly challenging. We can help you by consulting you and taking a medical history, including a menstrual history. We can also organize blood tests for you to check for hormone imbalances, as well as organize imaging of your ovaries to assess if they appear polycystic in nature. When a diagnosis of PCOS is made, this can often be managed either by a GP, such as myself. This can be managed by an endocrinologist who is an expert in hormone health, or this can be managed by a gynecologist who's an expert in women's health. Unfortunately not. There is currently no known cure for PCOS. The mainstay of management involves managing the symptoms that are caused as a result of the hormone imbalances. So for example, this may include medication to help you regulate your cycle. This may include cosmetic treatments to help with excess facial hair. This may also include treatments to help with loss of scalp hair. And in certain occasions, specialist treatment may be used, for example, to help with fertility concerns. At MediRadar, you can consult a GP and we can organize a scan for you. If you would like to have specialist blood tests, then that is also something that we can arrange for you. As a Cinnamon Healthcare GP, we look forward to consulting with you and helping you on your healthcare journey and addressing your medical concerns.